coach. So I help moms who work as executives manage the physical challenges of motherhood. Now, this could range from neck pain, back pain, poor posture, or a weak pelvic floor, or anything in between. So, going back to the topic for today, what can be the cause of your outer thigh pain? Now, there can be multiple causes. Of course, they're all very varied, but the commonest one that causes outer thigh pain, I'm going to talk about that specific topic today. Now, this is known as a iliotibial band syndrome. It's a long name. Some people call it ITB syndrome in short. Now, what exactly is the ITB? Now, what happens is you have a thick fascia on the outer part of your thigh. When I say fascia, it's basically the covering on your muscle, anywhere on the body, is known as a fascia. So, like you have the covering on a book. So, if you're reading a novel, if you look at it carefully, there's like a thin plastic film on top of the cover of the novel or the book. Like that, your muscles have a covering on top of them that's known as a fascia. In some of the areas, these fascias are quite thick, like the base of your foot on the side of the outer thigh. So this fascia is known as, it's so thick, it is actually called a band, that is iliotibial band or ITB. Now it runs right from your hip joint. So when I say hip joint, that is um, and on the top of your leg where it attaches into your, well, into your trunk area, into your pelvis. So it runs from your hip joint all the way down into your outer thigh. So what happens is the pain can be very varied. You could either feel a pull or a nagging pain on the knee end, that is the outer part of the knee, or you could feel it on the outer part of the hip or anywhere along the course of that ITB from your hip to your knee joint. Now, how would you feel this pain? It actually depends on how much of an inflammation you've got in your ITB. So it could be that you go for a run or some aggravating activity, which I will just cover after this. You go for a run or a swim or any activity that aggravates your outer thigh pain. And it could be that you have excruciating pain at that time, or it could be at rest that you get your nagging pain or burning pain in the ITB. So it's very varied depending on why, what is the stage of inflammation. So inflammation, if you have, say, just started off with the inflammation, uh, you can just have pain when when you're doing the activity or after the activity. However, if you have a chronic inflammation, the pain would be like a tightness that is present on your outer thigh. So imagine if you're wearing a trouser that is, the trouser leg is very tight, especially on the outer part. That sort of tightness will be felt in your ITB on the outer thigh. Yeah. So it could be like a pulling or a nagging sort of a pain, or it could be burning sensation as well. Now, why do we get this ITB pain? Now, most of the time, most of the population that I've seen with this ITB or outer thigh pain are runners. So if you have an improper running technique, or say you're into sports like swimming, where you are swimming and you repeatedly bend and extend your knee, right? So you're basically bending your knee and then straightening it out repeatedly. So basically, improper techniques during sports like running, swimming, cycling, that could be one of the causes. Or it could be that you have uneven leg length. So one leg is longer than the other. So, or you have flat feet, or you have other mechanical problems with your leg. So that is causing like a mechanical stress on the outer part of the thigh, causing this problem. Okay, poor posture. If you're one of those, which I was also guilty of at one point of time, if you're one of those who sit with one leg under your bottom when you're sitting on a chair, or even when you're sitting on your bed or your couch, then you can have this problem in the outer thigh, right? So an easy way to combat this is, it's of no use telling a person not to sit with that leg tucked under your bottom. So easy way to combat it is, if you're sitting with your right leg under, then after some time swap over, put your left leg under. So basically you balance out the two sides. Okay. So that is also one of the causes. So poor posture, and of course when you're sitting with one leg tucked under, there's a lot of other things that come in, your lumbar spine and everything, your whole posture goes into a poor posture mode. All right, so these are some of the causes. Okay, these are some of the reasons why you can get outer thigh pain, which is known as the ITB syndrome or iliotibial band syndrome. Oh, I'm going to go off the video now, but then the next time I come on, I'm actually going to give you some easy simple tips to manage this pain. So I will see you in the video next time, and I will address this. I hope this was good enough to clarify why you get the pain, because if I gave you just the management strategies as to how can you manage that outer thigh pain, you first need to know why are you getting that pain, and then you'll be able to learn or understand better how to manage the pain. Alrighty, guys, I hope that was a little bit useful, a little bit of theory, not too boring, I hope, but I hope you understood it, and then you can follow on with my next video better. Alrighty, I'll see you guys next time. Bye for now.